Hello everybody, welcome back to my channel. My name is Pinky. I'm an advanced clinical pharmacist practitioner. Today I'm going to discuss about bacterial vaginosis. I have already made a video on vaginal thrush. Okay, so I decided why not make a video on bacterial vaginosis. It is a common complaint made by women of reproductive age. Okay, they complain about milky discharge, fishy smell, malodorous smell. Okay, and it does come with complications, like say for example patients who has got pelvic inflammatory disease. Pelvic inflammatory disease means inflammation or disease of the genital area of women, like the womb, the fallopian tube, the uterus. Okay, and also who has got late miscarriage, preterm birth. So as we were discussing about the complication, we discussed about the pelvic inflammatory disease. Okay, and there can be other complications as well, such as post-operative infection, that is after the surgery of the uterus, post hysterectomy. Then there can be adverse pregnancy outcomes such as late miscarriage, okay, premature rupture of membranes, preterm birth, that is giving birth to a live baby before 37 weeks of pregnancy. There can be infection before and during labor, and there can be also infection of the inner lining of the womb. So these are the complications of bacterial vaginosis. So the complications is done. So we are going to discuss about how do we diagnose bacterial vaginosis. In primary care, diagnosis of bacterial vaginosis is pretty simple. If a woman comes and complains about fishy, smelly, white discharge, okay, without any inflammatory symptoms, without any inflammation, then I will start the treatment. Okay, now if the infection happens again, if the infection doesn't resolve even after starting the treatment, then I am going to request for some laboratory testing. Okay, so this is how we treat, this is how basically we diagnose and start the treatment in primary care for bacterial vaginosis. Now I'm going to discuss about the most important bit. Okay, the most important bit is the general advice and the risk factors. So it's very important to screen patients where there are sexually transmitted disease, or sexually transmitted infection is considered, because they're at high risk. Okay, another thing I always advise my patient is avoid vaginal douching, that is cleaning of the vagina. Okay, avoid that. Do not use shower gels, avoid shampoos or antiseptics in the bath. Topical treatment may affect efficacy of condoms. It is something also important to remember. Okay, and combined hormonal contraception and condom may protect against bacterial vaginosis, and I also advise patients to avoid oral sex. Now let's discuss about the treatment, which is a very important bit, isn't it? So the first line is oral metronidazole. Oral metronidazole 400 milligram twice a day for 7 days, or oral metronidazole 2 gram immediately, or intravaginal metronidazole 0.75% once daily for 5 days, or intravaginal clindamycin cream 2% once daily for 7 days. There are alternative treatments as well. Alternative treatments are oral tinidazole 2 gram immediately, or oral clindamycin 300 milligram twice a day for 7 days. So these are the treatments for bacterial vaginosis. It is very important to discuss about the treatments in pregnancy and breastfeeding. Okay, now there is no evidence of teratogenicity from the use of metronidazole in pregnant women. However, there are some recommendations which you really need to remember. That is, treat symptomatic bacterial vaginosis in pregnancy as in non-pregnant women. However, metronidazole 2 grams should be avoided. Okay, Metronidazole 2 gram immediately. That dose, it needs to be avoided. Consider treatments of asymptomatic pregnant women with bacterial vaginosis and additional risk factors for preterm birth before 20 week of gestation. This is very important as well. Use intravaginal preparations if breastfeeding. Oral antibiotics may enter milk. And as I was saying that, intravaginal preparations should be used in breastfeeding because oral antibiotics may enter milk and affect the taste of the milk. So for recurrent bacterial vaginosis, if it is recurrent, like if it's happening again and again, we will refer the patient to sexual health clinic to confirm the diagnosis, okay? And obviously lifestyle advice, like avoid triggers like douching, shower gels, consider change of oral contraceptive. Like it's very important to change contraceptive method, like use oral contraceptive pill rather than like intrauterine device, okay? And with recurrent bacterial vaginosis, we often prescribe like antibiotic prophylaxis. That means like treatment so that the bacterial vaginosis cannot happen, such as oral metronidazole 400 mg twice a day for 3 days at start and end of menstruation, oral metronidazole once a month, and then intravaginal gel 0.75% twice a week for 16 weeks can also be used like as a prophylaxis. Then acidifying gels, which you can buy over the counter, and it is suggested that it can be used on alternative evenings for 1 month or longer if needed. Now this is all about recurrent, like advice on recurrent bacterial vaginosis. Patients often ask me if bacterial vaginosis is a sexually transmitted disease. No, it is not a sexually transmitted disease. However, symptoms can be worse by sexual activity, okay? And bacterial vaginosis is associated with increased transmission of sexually transmitted disease. So it is very, very important, like not to change like sexual partners very often. And so a woman can pass to another woman while having sex as well. So these are the things to consider. So I have explained quite broadly about bacterial vaginosis. Bacterial vaginosis, basically it is caused by a change in the natural balance of the bacteria in the vagina. So this is all about bacterial vaginosis. If you have any questions, put in the comment section. It's very important to know about bacterial vaginosis, the signs, the symptoms, the treatment, how to diagnose, what to do in case of recurrent bacterial vaginosis. Thanks for watching. Thanks a lot. Do like, share and subscribe my channel. Follow me on Instagram, follow me on Twitter. My Facebook page is Clinical Pharmacist Practitioner Pinky. And thanks a lot. Bye. Stay safe.